Assalamualaikum warahmatullahi wabarakatuh and very good day to you all. Today I would like to present paper titled Similar but Not Alike, the framing of COVID-19 in Indonesian and Malaysian newspaper. This paper is prepared by me, Haekal Ghiffari, and Associate Professor Dr. Safizan Muhammad. Right, so this is the table of contents of our paper today, and especially for this conference. And also, yeah, this is the introduction and the study background. Right, in 2020 we know that COVID-19 affect us severely, affect in many aspects, like in social, economy, and health all over the world. And during this calamity, the media plays an important role in covering the COVID-19 because it is prominent news and it is something new and it is dangerous also. Yeah. And the media construct their own stories in their coverage related to COVID-19 and they create new reality by this. And also we focus on Malaysia and Indonesia in this paper because they have similarities and differences. It is similar because Bahasa Melayu and Bahasa Indonesia, Malay language and Indonesia language is similar in terms of the meaning, pronunciation, and yeah, others. And also the geographic location is also similar because we are in a Southeast Asian countries and we are neighboring also. But we have a distinct population. Indonesia has more than 200 million population, while Malaysia has more than 30 million population. In terms of ethnic identities, in Malaysia, we can find Malay, Indian, and Chinese. But some Malay, they cannot speak Chinese. Some Indian, they cannot speak Malay, and so forth. But in Indonesia, regardless of we are Japanese, Sundanese, Balinese, and others, we are able to speak Indonesia. So in terms of ethnic identities and race that live in respective country is a very different. And also the government system, Indonesia subscribe the presidential and also republic, while Malaysia parliamentary and also federation. So it is a very different government system. So with this kind of narration, with this kind of statement, it brings to the huge question, the grand question of how socio-political and cultural similarities and differences affect how the health crisis is framed and presented, especially in Indonesia and Malaysia. Right, so it brings us to our research questions. Number one, what was the dominating frames utilized by Malaysia and Indonesian newspaper in covering COVID-19? Number two, we'll focus on the primary sources. And number three, we'll focus on the primary audience or the target here. So we bring this paper based on this literature review. Number one, there is a paper that covers COVID-19 framing in Nigeria. And number two, there is a paper that frames COVID-19 also. They discover the framing in COVID-19, but at the initial stage. And number three, there is a paper, they explore about the previous coverage of epidemics far before COVID-19, but the frame is a very, very prominent here as action and consequence were the two frames that journalists employed consistently to construct the stories of epidemic. So with this, we come with this paper that examines the COVID-19 framing constructed by Malaysian and Indonesian online newspaper at its initial stage. So this is the methodology that we use. We use the deductive content analysis and we use the quantitative content analysis with an interpretative approach to the quantitative results, the design, and the data collection. We select the star from Malaysia and the tick from Indonesia. This is selected because the widespread of distribution and the diverse audience and also the popularity of its newspaper. And we utilize COVID and coronavirus as the keyword. And also the data collection is along for 2 months or 60 days after the first case of COVID-19 was announced in its country, which is in Malaysia, the start is 25th of January 2020, while in Indonesia started from 2nd of March 2020. And we also can see the profile of our sample, the star and the tick, and also the total of news piece that we collected around 369. All right, so we are going to the results and discussion that we have now. All right, the framing. Malaysia and Indonesia has different prominent framing. Malaysia focused on action-oriented as 42% of its framing for action-oriented. The example, the news title, movement to be restricted, right? To be restricted is the action word. And yeah, most of the Malaysian on a newspaper frames like this kind of news. While Indonesia focused on uncertainty, which spread the fear, uncertainty, and stability, which accounted for 37%. And yeah, the example here, a Kuala Lumpur passenger with corona symptom died in Padang. The word corona symptoms and the word died, and they specify in Padang, specific location in Indonesia. It shows the uncertainty, it spreads fear and instability in the future because of this pandemic. Yeah, this is the differences, but the similarities here, we found the both newspaper were very careful to not publish news that are overly negative, like the framing of conflict shows the war between its maybe political parties or nations, and also the less coverage for rumor or conspiracy, which is may confuse the public and also create misleading, right? So in here, in terms of the source, Malaysia and Indonesia newspaper refer to the same source, which is the government. It includes the health ministries, the authorities, the spokesperson. So it means that the newspaper understand the need to get information from the authorities so that the information shared are credible and consistent from the government. As the star counted for 50%, while the tick saved 67%, and both of them followed by the ordinary citizen, right? So yeah, the star is accounted for 12%, while for the tick 8%, right? So ordinary citizens here focus on the lives of everyday people, so that the narrative about the pandemic, it has become more balanced between the authorities, which are the decision maker, and the experience of public who deal with their decision related to the pandemic. Meanwhile, politicians are the least referred to by the newspapers, as it only has 2% of the coverage on the total. This is purposeful because sometimes the political focus on the political benefit, and also the politicians create a confusion among the public in a way sometimes. So the newspapers during the COVID-19 try to avoid this as minimum as possible. And for the target, the main target here is the risk bearer or risk takers, as the goal of the newspaper to shape the public opinion during the pandemic. And also when the dangerous is reduced, it becomes the epidemic. And also the role of media is just the same here. And the second, this arbiter or those in charge of making pandemic policy were the second most important target of Malaysian and Indonesians, 34% and 31% respectively, because majority message that address risk arbiters aim to assist them and to encourage them, the policymaker, to take a better policy by informing them of what other countries had done to combat the outbreak. So it can be a good example for them. It can be contextualized, and also it can be evaluation for them. So the better decision for policymaker, yeah, because it will happen because of the news. And also these generators or the troublemaker had the lowest percentage as the Star's news target, accounting only for 4%, while the tick targeted researcher and informer as the least, as it is only 1% here. Why this happened? Because both online newspaper in Indonesia and Malaysia are trying to be solution oriented, to solve this issue together. And also at that time, at its initial stage of COVID-19, there were less finding about COVID-19. So those might be the reason of this happen. And yeah, the targets are adopted from Holt and O'Hare at 2010. It means like the category of the target we adopted from prior work. And yeah, the conclusion of this paper is online newspaper in Malaysia and Indonesia refer more of the news from the government and set the public as the main target of information. And also its country has its own approach to frame the news, as Malaysia focus on the action-oriented and Indonesia is uncertainty-oriented in terms of their framing. And also the study suggests that newspapers should focus more on action and consequences rather than action and ambiguity, because being overly optimistic, it may lead to irresponsibility, while being overly gloomy, it may lead to misunderstanding and dissatisfaction among the public. It may affect negatively to the public, and it may decrease the trust, especially to the government and for the overall public as all. And also, this paper proposed that as the main source of information, government must be precise, brief, and impartial in order to streamline the crucial information in dealing with the health crisis, especially COVID-19. So it means that in the future, when nauzubillah there another pandemic or health crisis or maybe epidemic in specific country, yeah, the government must be precise, brief, and impartial to streamline the crucial information and to work together with the media to provide the best information for the public, for the policymaker, for the researcher, and for any other target. We hope this paper can be beneficial for academicians, for health practitioners, and also for the policymakers. Thank you very much.